Did you know that doctors have actually restored sight to blind patients using their own teeth? Yes. In one of the strangest and most miraculous medical procedures ever developed, surgeons discovered that the key to vision could come from your mouth. This isn't science fiction. It's called the tooth and eye surgery, and it has changed lives in ways that sound impossible. Welcome back to Did You Know?, where we uncover the strangest, most unbelievable facts hidden in history, science, and the human body. And today, we're diving into a surgery that sounds too bizarre to be true, a procedure where a tooth becomes an eye. Blindness can have many causes, but for patients with severe damage to the cornea, the clear front layer of the eye, the situation can be hopeless. Normally, a corneal transplant might restore vision. But for people with conditions like chemical burns, scarring, or autoimmune diseases, transplants often fail. Their eyes simply reject the new corneal tissue. For these patients, the world stays locked in darkness. That was the case until doctors thought outside the box, or in this case, inside the mouth. In the 1960s, an Italian ophthalmic surgeon named Professor Benedetto Strampelli began experimenting with a radical idea. What if you could replace the damaged cornea not with donor tissue, but with something else from the patient's own body? Strampelli realized that a tooth, with its hard structure and ability to support tissue, could actually serve as the perfect anchor for a lens. He developed what is now known as Osteo-Odonto-Keratoprosthesis, or OOKP. Decades later, this strange concept would become a last-resort miracle for patients considered permanently blind. The process is long and complex, but here's the simplified journey. Tooth extraction. Surgeons remove one of the patient's teeth, usually a canine, along with a piece of jawbone and gum tissue. Implant creation. The tooth is carved into a small block, and a hole is drilled to fit a tiny optical cylinder, a lens about the size of a watch battery. Cheek incubation. The tooth lens implant isn't placed into the eye immediately. Instead, it's implanted under the patient's skin, often in the cheek or shoulder. Over several months, blood vessels and tissue grow around it, making it a living, functioning part of the body. Eye implantation. Finally, the implant is removed from the cheek and placed into the blind eye. The artificial lens allows light to pass through, bypassing the scarred cornea. The result? Light reaches the retina again, and the patient can see. Why use a tooth instead of synthetic material? Because it's the patient's own tissue, it won't be rejected by the body. Teeth are strong, resilient, and can bond well with surrounding bone. The tooth essentially becomes the natural housing for the new eye lens. It's the perfect fusion of biology and engineering. The most astonishing part isn't the surgery itself. It's the people whose lives it has transformed. One British woman, blind for over 20 years due to corneal damage, underwent the procedure. The first thing she saw after decades of darkness was her daughter's face. Another man, blinded by an acid attack, regained enough sight to navigate the world independently again. He described the moment as a second chance at life. For many, it's not perfect vision. They may see shapes, outlines, or blurred images, but after total blindness, even that is nothing short of a miracle. Despite its success, OOKP isn't common. It's an extremely complex surgery requiring collaboration between ophthalmologists and dental surgeons. Only a handful of specialized centers in the world perform it, in places like London, Los Angeles, and Rome. It's reserved for patients who have no other hope when all conventional treatments have failed. And yet, for those few, it's the difference between a life in darkness and a life with sight. The tooth and eye surgery reminds us of something extraordinary, that science often finds answers in the most unexpected places. Who would ever imagine that a tooth, something we usually think of as separate from vision, could hold the key to restoring sight? It shows us that medicine isn't just about technology, but about creativity, persistence, and sometimes radical thinking. So the next time you think teeth are only good for chewing, remember this. Somewhere in the world, a person can see their family again, thanks to the power of a single tooth. Did you know that a tooth could restore sight? Now you do.